Good morning, everyone, and welcome to the Connecting Communities and Schools webinar series. So we're going to go ahead and get started. Welcome. My name is McLean Gutkin. I'm the local wellness policy coordinator at the Medical University of South Carolina and the Boeing Center for Children's Wellness, and I'm a member of the Schools Network. And so the mission of the Schools Network is to identify and promote healthy eating and active living strategies in South Carolina public schools that empower key stakeholders such as yourselves and encourage collaboration among those seeking to improve student health and academic achievement. And I'm joined by my co-host, Erica Ayers.
Thanks, McLean. My name is Erica Ayers. I am the Executive Director for the South Carolina Governor's Council on Physical Fitness. I'm also the School Wellness Consultant with DHEC's Division of Nutrition, Physical Activity, and Obesity Prevention. With the Governor's Council, their mission is to support the health of all South Carolinians through the advancement of physical activity. And they're currently focused on supporting student health and fitness, which is why they now work collaboratively with the Schools Network. An example of that collaboration is this webinar series. So we've been doing this for over a year now, which is very exciting. If you've been with us along the way, thank you for participating. If this is your first time, we're happy to have you. The purpose in the webinar series is to enhance collaboration between schools and communities using the whole school, whole community, whole child model as a framework to support student health. And the reason why we're doing this, and with some data relevant to today's topic, is that 1 in 4 children face hunger in South Carolina. And from our South Carolina FitnessGram data, we know that 2 out of 5 public school students are overweight or obese. So what do we do about this data? How do we address it? We work together, and we work together using the whole school, whole community, whole child model. This model provides a framework for greater collaboration between schools and communities across multiple sectors. And what's most important is it puts the child, the youth, the student in the center and takes a comprehensive approach to addressing and supporting their health so that they're ready to learn. So today we're going to do a deep dive into the nutrition, environment, and services part of the WISC model. Our excellent panel for today is going to give examples of what that looks like in South Carolina.
So for today's webinar, I am very happy to introduce Carrie Hollyfield, a program coordinator with myself at the Boeing Center for Children's Wellness, and also Farah Wiggins, a registered dietitian at DHEC and the Division of Public Health Nutrition Practices and the SNAP Ed program.
Well, thank you so much for having me today. I'm really excited to be talking about one of my favorite topics, which is school meals and how we can support our school nutrition departments. My name is Carrie Hollyfield. My background is as a registered dietitian. I've previously worked as a WIC nutritionist and as the registered dietitian for a large school district here in South Carolina. Currently, I work for the Medical University of South Carolina, Boeing Center for Children's Wellness, where I offer support and motivations to schools as they implement their school-based wellness initiatives. So let's go ahead and dive in. The first point is knowing why school meals are so crucial. And we know that 34 million people within the United States, including 9 million children, are food insecure. And what does that mean? Well, food insecurity is going to be the lack of access at times to enough food to live an active and healthy lifestyle. We also know in South Carolina, we have food deserts, which are going to be the lack of access to nutritious and healthy foods. And then there's also a new term being thrown around called food swamps, which we also have in South Carolina, which are areas with higher density of fast food and junk food options rather than healthy food options. And these layers just compound each other. It's also true that 18.3% of South Carolina children are experiencing food insecurity. And I believe McLean's going to drop a link in the chat if you would like to go to it. It's the Map the Meal Gap from Feeding America. And as we go to this link, we want to look at the different counties and the food insecurity that our children are facing in these counties every day. And you will see up at the top, there's a child demographic. So if it's on the adult one, you can go to the child one. So looking at this map, the dark green are going to be the most highest rates of food insecurity within South Carolina. And you'll see a lot of mid to higher percentages in the 20% for food insecurity within some of these darker green areas. But even in the light green areas, the food insecurity rates are just far too high. Thank you so much, Erica. So if we go back to our slide, how do we help with this? Well, we have some good news. We have school meals and school nutrition services departments. We know that 30 million students across America eat school lunch every single day. And that's just the lunch program. That's not including the breakfast program or the other programs that they offer. We also know that students who eat school breakfast, they have higher math test scores, 17.5%. And then on top of this, we often know students some of them only get their single meals from schools each day, which can bring them into the school itself to become educated. And so we see attendance rates rise. In fact, 1.5 more days of school per year students attend if they eat school breakfast. So school meals, it supports prevention of obesity, your overall student health, academic achievement, improving diets, and combating hunger. In fact, in a recent study by Tufts, it was found that schools are now the single healthiest place Americans are eating. And this is compared to restaurants, entertainment centers, and even the grocery stores. On top of this, another recent study found that nearly 1/3 of children aged 1 to 5 did not eat a daily fruit, and almost half of children aged 1 to 5 didn't eat a daily vegetable. But the great news is that when these children become a school age and are enrolled in school, they will be offered a fruit or vegetable with every single meal they eat for school meals. Next slide, please. So I believe the first step in support is understanding. And no matter what level at the school you are, whether you are a teacher, an administrator, a principal, a community member, a school nutrition services professional, being able to take what I'm saying and disseminate this information to others is so important so that others can understand why school meals are the way they are. So I think one of the biggest misnomers or misunderstandings is that school nutrition departments are actually self-sustaining. What does this mean? Well, I like to think of them as mini restaurants. They have their own budget. They do not fall under the general fund of the school district itself. So this means that their income solely relies on government reimbursement, cafeteria sales, and occasionally some grant funding if they are able to receive it. So food costs, equipment costs, salaries, wages, transportation costs, unpaid meal debt, etc. All this falls within the school nutrition department to be able to manage and budget. Secondly, school nutrition meals, they are mandated to follow very strict USDA guidelines, and we will get into these guidelines in a few slides down. But on top of this, they do have administrative reviews conducted by the State Department. The State Department will go into the school district and make sure the recipes are being followed, the ingredients are what is being used, that the schools are meeting their guidelines, and that even the reimbursement and claims are being correctly entered. The USDA requires each school district to have a local wellness policy in place. And what is this local wellness policy? Well, it sets goals for nutrition education and promotion, physical activity, and other school-based activities that promote student wellness. And the School Nutrition Service Department has what's called a Coordinated School Health Advisory Council to help meet these local wellness policy initiatives. And this CSHAC, as it's abbreviated, it should be formed up of members of the community, board members, parents, students, community members, school representatives, food service department staff, so that they can help implement and meet these local wellness policies. And then the last fact that I want to share for today is that food companies have what we call K-12 school nutrition lines or segments. And so the big name brands that you see at the grocery store, they also make specific K-12 meal food lines. So Kellogg's, General Mills, Schwann's, Tyson, etc. they all have K-12 segments, and they do an incredible job at making sure the menu items they serve to our schools meet those USDA requirements. They will even come to the schools and help the school nutrition make sure that they're making them as quality and efficiently as they can. They will work with schools to make sure the nutrition facts are meeting special diet needs for students, and they really do go above and beyond. So I want to share an example of this. Next slide, please. And I want to preface this, by no means am I sponsoring Kellogg's or Pop-Tarts, but I think this is a really good example of a menu item you may see on your school's website that is a K-12 item and not a grocery store item. So a Pop-Tart. On the left-hand side, you'll see a K-12 line Pop-Tart. You'll see that the first ingredient is whole wheat flour. There's no high fructose corn syrup. It's only one pastry in the package, 115 milligrams of sodium, 3 grams of dietary fiber, and then 14 grams of added sugar. Whereas in the grocery store, if you were to go, you will see the commercial Pop-Tarts. The first ingredient is going to be enriched flour, so not whole grain. The second and third ingredient is going to be corn syrup and high fructose corn syrup. There will be 2 pastries per serving, which doubles the sodium and doubles the added sugar. And then only 1 gram of dietary fiber because of the lack of whole grain versus the 3 grams of dietary fiber that you'll find from the whole grain Pop-Tart in the K-12 line. And this goes for all the K-12 menu items. You may see chicken sandwiches on your K-12 line, on your school menus, but it's going to be whole grain breaded, and it's going to have maybe a third of the sodium that you find in, say, a Chick-fil-A sandwich. And this goes for pizza. The pizza might be it will be whole grain crust, and they might lessen the cheese to help reduce saturated fat. It might be turkey pepperoni to help reduce that saturated fat. Everything you see on your school menu is completely made specifically to meet those USDA guidelines. Next slide, please. So I want to talk into depth about what the regulations are for the National School Lunch Program. So there are 5 meal components that need to be offered daily. And these are going to be your vegetables, your fruit, your grains, your meat alternates, and your milk. But then we have to get into the specifics. For vegetables, there's actually 5 subcategories that schools have to meet every single week. And those are going to be dark green, your red orange, legumes, starchy, and an other, which is like green beans or maybe something more random like mushrooms. But all of these have to be met every single week. You will see fruits, but they really push for whole fruits. So only half of your fruits can come from juice. Grains, they have to be at least 80% whole grain rich. Meat alternate, what does that mean? So meats are going to be your animal-based proteins for the most part, your hamburger patties or chicken patties, and meat alternates more of your vegetarian protein options such as peanut butter or maybe yogurts. And then your milk, and your milk can be fat-free or low-fat, flavored or unflavored. But then on top of this, you have to meet a 5-day weekly average based on your grade level for calories, saturated fat, sodium, and then trans fat. And I want to show you what these guidelines actually really truly look like. So Erica's going to pull this up for us. So this lovely confusing chart is what school nutrition directors will be using. But I just wanted to pull this up to show you that it's based on the grade level. You'll see the components on the left, and then at the very top is based on what grade level, depends on what you must meet. So how much meat alternate, how many grains. And there's a daily level and then a weekly level that you must meet. And at the bottom, you'll see kind of the average amount for a 5-day week that they have to meet for the sodium level, calories, and then saturated fats always going to be less than 10% of total calories. You can go back to my slides. And so moving right along, I do want to talk about the National School Breakfast Program as well. So this is going to have 3 meal components that must be offered every single day. And this is going to be your fruits, grains, and your milk. Now, vegetables and meat alternates are not required in the school nutrition breakfast program. Why is this? Well, there's many reasons, but I will say this. Reimbursement rates for the National School Breakfast Program is less than the National School Lunch Program, and meats as the center of the plate are very expensive. So to help combat this, there is a certain rule in the National School Breakfast Program that if you are to meet the first requirement for your grain component, you can actually replace your grain with a meat alternate and claim it as a grain. It's kind of a fun little fact. But it does help offset that cost and helps bring some protein options into your school breakfast program. Vegetables can also be in replacement of fruit, but they have to be from certain categories first before you can do that. And then again, other specifications, they still have to meet by grade level a 5-day weekly average for calories, saturated fats, sodium, and trans fats. And the same rules apply for the fruits, grains, and milk as they do for the National School Lunch Program. So continue right along. So the USDA has just proposed some updates, and these are just proposed. They have not been put forth in motion yet. In fact, they're asking for comments. And so my suggestion is after this conversation today, go to your own school nutrition department leaders and say, hey, we heard about these USDA proposed updates. What are your thoughts on them? And how do you feel about them? They will be the best ones to guide you on how they are thinking about these rules. But just to bring to light, so added sugars, they are considering reducing to less than 10% of calories per meal. And that would kind of follow like the same saturated fat guidelines, things like that. Also to limit added sugars in grain-based desserts, breakfast cereals, yogurts, flavored milks, etc. For the milk, there's a couple different proposed options. They would all still fall in line with the reduction of the added sugar, but there's some proposed updates about only allowing younger grade levels to have white milk and the chocolate milk only be for the upper grade levels. And then the other proposed rules are about reducing sodium and increasing whole grains. And we can go to the next slide. So another way that we can support our school nutrition departments is by helping to reduce plate waste. And one ways we can do this is really understanding offer versus serve programming in our school nutrition services meal programs. So offer versus serve, it allows students to have meal choices. And how does it do that? Well, we always offer all the components required for all our school meal programs, but for lunch, students, they only have to pick up 3 components, one of which must be a fruit or vegetable. So what does this mean? If a student just wants a chicken sandwich and an apple, that's fantastic. They're meeting their grain component, they're meeting their meat alternate component, and they have a fruit. But they can still pick up all the other components. Say they want a carrot bag and a milk. Well, great, then they get all 5 components. For breakfast, students must pick up 3 items with one being a fruit or vegetable. Just keep in mind, students can always pick up all components, but this really truly does help with plate waste and student autonomy as they're picking up their meals. Other ways we can support decreasing plate waste. Scheduling recess before lunch. This can reduce plate waste as much as 30%, getting our students active, getting them moving around, getting their bodies ready to then eat and consume meals. Extending our lunch periods from 20 to 30 minutes. That gives students about 25 minutes of seated meal time where they are able to consume and mindfully eat their food and have time to eat their food. Truly reduces that plate waste. And then farm to school programming. Students who have farm to school programming, such as school gardens, they're able to try new foods, try new things, be open to trying new foods that may be on that cafeteria line, and respect where their foods are coming from as well. And this helps to reduce that plate waste. Next slide, please. School nutrition programs also have additional meal services outside of breakfast and lunch. A lot of districts will also offer after-school snack programs, which offer still USD mandated specific nutrient contents for these snacks. They'll offer supper programs. They might even have early learning centers for children under the age of kindergarten through the Child and Adult Care Food Program. So these can literally be infants on formula, transitional foods, and then toddler foods up and through the National School Lunch Program. So some school meal programs are serving infants through high school, 12th grade. And then there's also the summer meal program where we know food insecurity is extremely high during the summertime, and this allows children to still receive healthy meals during the summer. Next way we can support is taking steps to become Smart Snack compliant. And Smart Snacks are required by law for the USDA. And this includes anything in the school, such as fundraisers, school stores, vending machines, etc. And why is this so important? Well, I want to go back to school nutrition departments being self-sustaining. So oftentimes vending machines are through the general fund of the school itself. So they are not overseen by the school nutrition department. And so that becomes competitive for the school nutrition department. If snacks are being sold in the vending machines that are not Smart Snack regulation, and school nutrition departments are only selling Smart Snack regulated foods, sometimes children, they might choose the other foods in those vending machines outside of what are Smart Snack. And that's direct competition with their own school nutrition department in their budget. But not only this, we know that Smart Snack compliant foods are healthier for our children and for our staff. So how do we become Smart Snack compliant? Well, first we need to understand the Smart Snack standards and their nutrition requirements. And I know these PowerPoints will be sent out later, but this guide is linked and you can always go to it as well. Next would be to complete an inventory of foods and beverages sold on school campus. See what's already out there, see what's being sold. Then I think this is the most important step. Gaining staff and student buy-in and providing nutrition education surrounding Smart Snack importance. And then finally, replacing foods and beverages that do not meet Smart Snack standards. If your school cafeteria is selling a la carte items, those are Smart Snack regulated. And so you can even discuss with them about how do you purchase Smart Snacks and what Smart Snacks can you fill your vending machine and school store with. Next slide, please. So the School Nutrition Association, they did a huge survey to see what challenges school nutrition departments around America are facing. And they found that financial were some of the biggest challenges, with 99.8% indicating that increasing costs were extremely challenging. Not only this, but during COVID, we had waivers where all kids ate for free, but that waiver expired. And so now children are back to being on paid, reduced, or free lunch. And we've seen an increase of about 66.8% of stigma for low-income students through that loss of free meals for all. But with the loss of free meals for all, we've also seen 96.3% increase in unpaid meal charges and debt. And we've seen participation drop, and as well as 90.6% have cited that they've seen a decrease of parents being able to submit meal applications to receive free or reduced meals. They've also cited challenges with supply chain and nutrition standards. So more than 90% of respondents face challenges with menu item shortages, discontinued menu items, and just supply shortages in general. And then we've also seen a staff shortage as well. I always like to say, if you have trouble finding a food in the grocery store that's made on the consumer line, you're going to have a really hard time finding the K-12 segment line in the schools for supply shortages. Next slide, please. So overall, how can we support our nutrition service department? Well, like I said before, we can ensure all outside food items are Smart Snack compliant. When menus change, be understanding and communicate effectively to your nurses and parents about why these changes are happening, whether it is a food supply shortage or financial or what have you, just being open and honest about that. And then as a school, promote the school meals with flyers, announcements, social media posts, etc. Parents, communities, staff, they only know what they see and they only know what they know. So if you aren't posting and promoting the amazing things you're doing in your school nutrition service department, you need to do so. That way people will acknowledge and see all the hard work you're putting in every single day. Holding taste tests to bring excitement around new menu items is a great way to support your nutrition services department and your meals. And then ask to attend that next coordinated school health advisory council meeting to better understand and discuss the barriers your nutrition department is currently having. And I put understand before discuss. Listen to what your school nutrition service department has to say, and then discuss that with them. Next, please. You can also support with grants and community partnerships. There's an amazing grant called the Fresh Fruit and Vegetable Program grant, where children can try new fruits and vegetables every single week, some of which they may never have seen or been able to try before. Community partnerships, registered dietitians, field trips to local farms, farmers visiting your school, produce giveaways, etc. I mean, you can call up your local hospital and say, hey, is there a dietitian on staff that would like to come to our school to talk about healthy nutrition to our students? Chances are there is somebody out in your community that would love to do this. And then farm to school grants and programs. There's school garden and education assistance program. There's Whole Kid Foundation school garden grants. Harvest of the Month, where your school nutrition department can purchase local produce and have a new recipe on the line for the kids to try. There's so many different programs that your school can implement to help support and spread awareness about the great meals being served every single day. Next slide, please. And then lastly, I just want to point out, it truly does take a community of support. Parents, they can encourage children to try new foods at home. They can encourage grocery store shopping and cooking together. Teachers, you all can have nutrition lessons in the classroom that relate back to standards. You can apply for these grant applications for your school nutrition department wellness and school garden grants and grants like that. Students themselves, they can form an advocacy group or even form a wellness committee. Administrators, you all have a tough task, but implementing that local wellness policy within your school and making sure that maybe students do have recess before lunch and do have 30 minutes of actual time to eat and are always Smart Stack compliant. And the community partners, donating your time, services, and supplies, letting your local school know, hey, I'm here. How would you like any assistance or any help with anything? Next slide, please. So May 5th, 2023 is National School Lunch Hero Day. I want you all to write this down. So with this day, you can do so many things, but here's just a few ideas. Have students write letters of support. If you're a community partner, write letters of support. If you're a teacher, maybe having a lesson on what food insecurity is, or even having students create their own menu based off of the USDA guidelines so that your students start understanding what it takes to actually make school meals. Maybe even having them do a tour of the school kitchen. There's so many things that can be done with this, but be sure to support and motivate and just say thank you for all you do on May 5th. Next slide, please. So I know this is a ton of information in a short time. So I want you to feel free to email me at hollyker@musc.edu with any questions or ideas that you may have. And lastly, I'll just end on, make sure you eat your greens. Thank you so much.
Thank you so much for that excellent presentation, Carrie. I really appreciate hearing all your expertise. And I'm going to turn it over to Farah Wiggins from DHEC.
I love it. It looks like I'm in the right place, McLean. Good morning, everyone. I'm Farah Wiggins, and I'm a registered dietitian with the DHEC SNAP Education Program. And I'm excited. It's National Nutrition Month, so I couldn't think of a better time to do this talk. And I wanted to share, I have been a dietitian for almost 20 years now. I can't believe it. But, you know, the majority of my career has been in the clinical outpatient world, which has been wonderful. And I realized that I really wanted to jump into the public health and prevention side about 3 years ago. So I joined public health 3 years ago, and right with COVID. So I was learning multiple ways to do this job, but I've been really excited to to meet some of you. And I know I've seen some familiar names on the chat, and really go out and do our job the way that we should be doing it. So I'm excited. So let's go ahead and jump in. Next slide. So SNAP education, for those of you all that are not as familiar, our goal is to enhance nutrition education throughout the community. So we work with a program that's evidence-based, and we have direct education. We use policy systems, environmental change support, as well as social marketing. And I'll back up. The policy systems environmental change support is a great way to think of that is, nutrition support for your community, for your school. Same thing, physical activity support for your community, for your school, wherever your environment is. So direct education is where we come in and provide direct education to your students, to whoever it is. And I'm going to go through who we serve in just a moment. But that policy systems, it sounds very fancy, but really and truly it's that we provide that support and work with individuals like Carrie, work with McLean and Erica to help you all have your supports that you need, and to help make that environmental change or that systems change. So next slide. We're funded through the USDA and through a partnership with the Department of Social Services. And we have an annual grant that we apply for every year. Next slide. I can't go without speaking about all of us. So SNAP Ed is statewide. It's actually, throughout the country. And we have 4 implementing agencies here in South Carolina. So one being the DHEC, which is me and my great team. Clemson University, the Youth Learning Institute, offers SNAP Ed, as well as Low Country Food Bank and the University of South Carolina. So we're all a little bit different in what we do as far as different types of programming. I'm going to give you a short summary of Low Country Food Bank as well as Clemson University, because I have to speak about my friends towards the end of this presentation. So mainly what we're going to do is I'm going to talk about DHEC SNAP education and what we offer. And then I'll also include opportunities for those of you that live in those districts where Low Country Food Bank and Clemson University cover, so you can have access to them. All right, so without further ado, here we are. So this map is divided between the implementing agencies. So DHEC is the green locations. I see a lot of you on the call in my counties. So it's great to have you here. That is who we serve. So there is some overlap there where you'll see Hampton County has that blue and green. So we share you with the Low Country Food Bank area. So this map is pretty unique because I know for me in public health, as I got started, I was like, where is everybody? Where are we supposed to go? Who's my contact? So this hopefully can help you with knowing where, who to contact for SNAP education. Okay. Next slide. Again, this is a nice list of the counties that we serve. And I believe that you all will get copies of these slides so you can have this information to keep. If you also have questions, the counties that we serve, they are on our website as well. Next slide. Venues. So we're everywhere. Okay, give us a kitchen sink and some sanitary measures, and we can make it happen with nutrition education. So everywhere from Head Start programs to elementary schools, children's museums, rec centers, housing authority sites, drug and alcohol addiction centers, summer camps, county libraries, senior citizens, federally qualified health clinics, churches, food pantries. So a lot of our venues, most of the venues in the community, we can pretty much set up shop at and teach. Next slide. All right, so I'm going to kind of jump into a little bit of our programming. I could probably talk for another 2 hours about our programming, but we don't have time. So what I really want to focus on is to help you understand that we serve the ages of 2 to infinity. So if you're a senior, there are classes for you. If you have, schools, we teach classes in the schools. There are different types of classes. Some are a little bit more in depth than others. So what I'm going to do now is kind of go into the curriculum programs that we offer and give you a little bit better sense of that. So next slide. All right, so this is one of our adult curriculums. It's called It's Your Health, Take Charge. And it includes cooking demonstrations, and there are 6 sessions with this series. So we come in, it's about a 75 to 90 minute visit with our adults. And we go over label reading, we go over whole grains, fiber, salt, and sodium, talk about healthy cooking and shopping at home and what that looks like. How to stretch that budget. So our focus with SNAP Ed is to reach SNAP eligible recipients and or individuals that live in communities of low income that consists of about 50% of the community, for us to kind of to go into that area. So usually what we do is, if you all are interested, we will go, you can just contact us and we'll look at options, and we can really work around criteria. Don't hesitate if you have a question about that. We can kind of, do that homework for you. So this class is a great class. What we do is we teach, and then we really encourage the adults to help and volunteer to participate in the cooking demonstrations. Next slide. These are just some pictures of us in action. So, I think here I'm in Kershaw County, and we are, doing our salt and sodium lesson. So they were making salt-free spices to take home, and they kind of assisted and watched with our food demonstrations. We are registered dietitians and we're certified in ServSafe. So, we definitely practice safe food handling as we're out in the community. So I really want to enforce that. Next slide. This is one of our activity programs for adults. It's called Walk with Ease. This is a program that really, it's an evidence-based program that targets individuals, with arthritis. The research has been done with individuals with arthritis, but really and truly, this program is for everyone. You do not have to have arthritis to participate in our class. A lot of individuals do not, and we don't necessarily do any type of screening for that. This is a progressive physical activity class. So, those that, haven't really, they're not sure or comfortable with their walking environment or haven't really been walking, this is a great start, because we really start with looking at, 5 components of the exercise and the walk. We stretch, we walk them through the safety and the benefits of stretching. We walk them through that walk. We talk about safe areas to walk. If you haven't been walking and you head out the street and don't have any sense of where you're going, or if there's not a bench close by that you have access to, if you get tired, that can really hinder your ability to move forward and take action. So we really kind of talk about these things in the classes so that individuals can have some confidence and really start making changes. So this is an awesome class as well. And we conclude that cooking demonstration with it. I have one tomorrow, and we're going to make salad. So, we can't go, with a nutrition component, we can't go without having that there. So everybody needs to taste some food. Okay, so Cooking Matters. This is an awesome curriculum for adults. We do this with childcare professionals and caregivers as well. So this is a great class if you have parents interested in, cooking and healthy eating, but they don't necessarily have access to the dietitian for themselves, but maybe they need it for the environment at home. And so we go in, there's 6 lessons here, and we work with reading labels, practicing food safety, looking at grocery shopping, what it looks like. And we really encourage and enforce that you don't have to spend, $500 a month to eat healthy. I know, although right now it's a little challenging, but we help improve those skills and give individuals that confidence that they need to really make it happen on that stretched budget or on that income. And it can happen. All right. And then one of the bonuses with this class is, and that parents love, is that you get the take-home groceries provided to apply the skills that you learn in the class. So this is a 2-hour lesson, and each lesson is 2 hours, but it is very hands-on. And what you get to do is you take those groceries home and you get to implement what you've done at home for the kids to enjoy. So it's a very, very impactful class. Our coordinator is Lamar Hodges, and he does a phenomenal job with this class. So next slide. Sorry, I'm probably taking too long. These are just some pictures here of participants, and you can see, everyone's participating. It's very hands-on. The other picture is us. We were delivering groceries to one of the schools so that they could have them. And we actually did a virtual class for this group. I believe they were in Orangeburg. So, there's different, we can do virtual or in-person class opportunities as well. Next slide. Okay, and then cooking matters at the store. I really wanted to talk about this because we get a lot of requests to do a single session. And we actually provide more of a series type lesson, a curriculum. So with this is a single session opportunity that we offer. And so we kind of do a grocery store tour. If you've never done a grocery store tour, these are great opportunities to really apply hands-on skills that you can develop while you're receiving instruction. So these are great. We can modify this lesson as well. And actually we call it a pop-up where we do it in the class. So this is a group with the SC Fathers and Families organization. And we went to the class and we kind of used food labels and different models to provide the grocery store tour. So we, lots of pictures and improv, but it's a great class and people seem to really enjoy it. All right, next slide. Taking charge at the farmers market. We provide opportunities at the farmers market as well. So we'll set up a food demonstration and provide information. We really encourage and try to connect our SNAP EBT recipients and the senior vouchers to farmers and farmers markets that take SNAP. So that's one of the goals, as well as if we have, we'll work with a farmer if they aren't necessarily set up to take senior vouchers or SNAP EBT, we'll connect them to the correct individual to help with that. So usually we do these in the summer, and it's mainly, that sample table. You come over, you visit, we chat, and it's a lot of fun. Next slide. One of the Healthy Facts program is one program that we promote, and it is an incentive program that allows SNAP recipients to purchase additional fruits and vegetables for $5. So they pay $5 with their SNAP EBT card, and they receive $15 in Healthy Bucks tokens to purchase additional fresh fruits and vegetables. So, the Healthy Bucks program is a great program to get involved with if you're a SNAP recipient, because it gives you more for your money. Next slide. All right, so my school and preschool folks that are on today, our Taney Taste curriculum is so fun, and it's an awesome curriculum. It's geared more towards the 3 and 4-year-olds, but we have provided this curriculum to our kindergarten and pre-kindergarten groups, even first grade. It's a wonderful lesson. It's all based on a fruit or a vegetable. So it's like the produce of the month or the lesson. And we talk about, where that food is grown and, that it comes from a tree. Is it grown in South Carolina? Some of them, yes, and some of them are not. We use our senses to really use those skills that us as adults sometimes lose when it comes to eating. We call that, it's more so, the word's escaping me, but we want to smell the food. We want them to taste the food. We want them to feel it, and really kind of embrace, the food for what it is. It's called intuitive eating. It just came back to me. So we try to utilize those skills in that lesson. Okay. There's a newsletter that's sent home with the parents, and we sing a song with the group about the fruit or vegetable. So this is a wonderful, wonderful program that works for our little ones. Next slide. Okay, and this is our catch approach to child health. So this is our elementary school curriculum, as well as after school Kids Club curriculum, where we teach nutrition education and physical activity. So this is very physical activity based, and there's a lot of great research behind the catch model. So I know it focuses on that, that whole child, whole community. There's a lot of great research with this program. And so we are actually piloting it for the first year this year. So lots of great things to come with this program. And we're looking forward to moving into the further in the year with this. All right, and so this is us in action. I had some Florence folks on the chat here. So this is me actually not too long ago at Briggs Elementary School in Florence County. So we're doing a series with our catch curriculum with them, and yes, shout out. And this is one of the groups, and I had them hold their pictures over their face because we hadn't had our media consent forms yet from parents. So I said, just cover your face and we're going to take a picture. And they were like, what? But I thought it turned out cute, so I wanted to include it. But, we're in with this school. We've started with the nutrition education, and it's been a great way to build relationships with teachers. They have a farm to school, I call it extracurricular class. So I've worked with the farm to school coordinator and the farm to school teacher, and have conducted the class throughout the school during her lesson. And so it's really worked well. Our goal with them is to potentially work with, some of there's been some requests. And so we get to implement that policy systems environmental opportunity as we're getting to know the folks at the school. So it's been a great experience. The other picture is with Harbison West Elementary School in Richland County. And with them, we did a taste testing day. So super cool story with them is that they had a farm grant through Clemson Extension, and they were doing well and with their garden. I said farm, I meant gardening, excuse me. And so we harvested the sweet potatoes, and we were able to do a sampling day at the school. So the kids actually got to taste, sweet potatoes, and, from their own garden. And so it went over really, really well. And the food service staff was wonderful and worked with us to allow that to happen. So it was a great opportunity. Next slide. All right. So in addition to direct education, we offer this is our social marketing opportunity here, and it's our Text to Be Well program. So the idea here is that, it's a text messaging program. I'm a parent, and I know you all know about text messaging programs, so I don't think I need to go into it. I get a lot of texts from my school, but some of them are very, very beneficial. And this is a great way to continue to connect with the individuals after they've, received education from you, maybe in a 6-week series, and they jump on, and this just really kind of sends those messages and continues to help with them with overall behavior change. So it's a wonderful tool to just continue to build that knowledge over time. These text messages focus more around healthy eating, food resource management, and physical activity, food safety, all the things we do. So next slide. All right, and I'm going to go ahead and jump through this slide a little bit for the sake of time. So next slide, please. Perfect. So a little bit about the policy systems environmental change work. I've talked a little bit about that already, but I wanted to kind of focus on a few examples, where we can kind of support you here. So I'm going to make this up. So McLean with MUSC Boeing, she connected me with the Florence at Briggs Elementary. So she, and the community connected me. We went in, we're doing direct education there. And I have a teacher. I'm not speaking for Briggs, but I have had a teacher or two have some questions about improving their menus. That is not their plan. I haven't even spoken with anyone about this, but that's an example where I can kind of work with their school and their committees to coordinate and, kind of help with making some improvements and listening and recognizing what their concerns are. So that's just one example of a systems change that we can kind of help with there. Next slide. All right, so environmentally, this is an example. So this is the garden at the school that, yes, this is the garden at the school that we were talking about. I was talking about before at Harbison West. And the kids are out there, they're doing the work. They're, from the ground up, when you really get the kids involved, you start to see an appreciation, because they're vested. And so it's, this is an environmental change that has taken place at Harbison West. And the kids were super enticed to eat that sweet potato. So as things come out of their garden, what their teachers are doing are sampling and taste testing, and, they're making kale smoothies. They're really introducing them to various ways to prepare foods and find ways to increase fruits and vegetables. Okay, next slide. We also have a component of telehealth that we work with Prisma Health on. I have, if you're interested in telehealth, I have a contact for you, and I can share that in the follow-up information that Erica and McLean send out. But I think this is a great opportunity where we've been able to work with an after-school program at the schools in Richland County. And, it's telehealth, but we still can reach 5 different schools, in a 30-minute period versus, driving out to each of it's just a great alternative for the school programs. So next slide. Okay, and we'll go ahead and skip this slide, Erica, for the sake of time. So just kind of jump through this one. I want to just kind of talk about the South Carolina, the snack coalition stands for the State Nutrition Action Council. And so we have one. I just want you all to know that. And what their role is, it's a fairly new organization in our state, and they are working with the 19 state and local food programs to help support our efforts. So that is a list of all of the local programs that are available. And so I think the biggest thing here is for you all to recognize what those are and recognize where, who your supports are, because we're around and we're here for you. It's just, it's not always, we're not, a phone call or a door knock away. So, keep that list and keep our contact information because we're here to help. Next slide. Okay, so quickly, Clemson SNAP Ed and Low Country Food Bank were the two other implementing agencies that I talked about at the beginning of my talk. So these are their counties, and that map that I shared as well can help you learn from that. Next slide. And these are their program that they offer. So very similar in what we do and our objectives and our goals, but just a little bit different with the curriculums that we offer. So wanted to share theirs. And the next slide here is going to be their contact information. So if you live in the counties near the upstate, you may want to kind of, you guys are going to get the slides if I think so. That's perfect. If not, just snap a picture just in case to get their contact information. Next slide. And then Low Country Food Bank, the same. They're right on the coast. Their goals and purpose is very similar to ours. Next slide. This is where they are located. And the next slide. This is a link to their website here that is listed, and these are just some opportunities and curriculums that they offer. So they do, I know that they work with MUSC Boeing, and they have provided support systems to incorporate access at schools. So you definitely want to connect with your SNAP Ed implementing agency, where depending on where you are, for your ongoing support, because you don't have to do it alone. So next slide. All right, so next steps, just reach out to me and we can talk. It takes a while for planning. We do want to make sure that, we have to have agreements with our school districts or our schools, which sounds like a fancy name, but it's just basically we put an agreement together so that we can work with you all, and it's good for 5 years. So it's definitely worth the work, worth it to kind of go through and get that taken care of. Next step, next slide. And this is our contact information in our website. So it's been great. I appreciate everyone listening, and I hope I've helped you learn a little bit more about SNAP education, and I'm going to turn it back over to McLean.
Thank you so much for sharing with us, Farah, and thank you again to Carrie.
Sure.
So we are now in the Q&A portion. I do not see any questions yet. For those on the call, if you have any questions, please put them in the Q&A or the chat.
McLean, while people may be thinking of their questions, and I actually think I do have one or two if need to share, I just want to remind folks that we do have 2 more webinars for the school year. So our next one will be April 19th, providing healthy environments for healthy learners. So we're going to be spotlighting some environmental health people. And then May 17th, creating active environments for healthy learners. And so those registration links have been shared for a while now, but we can put those in the chat, and then they'll also go back out as follow-up items. Anything in the chat currently? Questions?
Yes. So Tammy Welsh asked, Farah, what is the curriculum called for K through 5th grade?
Sure. So we're transitioning right now it is taking charge in the Meadowland. You'll see that on our website. And we're transitioning to the Catch curriculum that I spoke about. So pilot is taking place now, and feel free to reach out to me with interest.
Thank you. And Carrie, you have a question from Wendy Sabarantz. Can you speak at a leadership meeting for administrators?
Wendy, always great seeing your name pop up. Hello. Potentially send me over an email and we can chat further.
And for everyone on the call, JC just put the survey link in the chat so that you can get a certificate of attendance.
Do they get, Erica, you are going to send the slides out. Do they get the slides?
They'll be in PDF format due to the size.
Okay. I kept speaking about it, so I was like, I hope they get it. Perfect. I have a question, Carrie. I would love to do the Food Hero Day at Briggs and have my students color something to make a mural on the wall. Or just, I hope, again, I keep speaking for Briggs, but you always have to get approval with everything you do. But is there a website with resources for Food Hero Day?
Absolutely. And Erica and McLean, I can send you this resource. So the School Nutrition Association, they have a whole toolkit with resources that you can utilize and ideas that you can use to implement a fantastic School Lunch Hero Day.
Love it. Perfect. Thank you.
And Farah and others, I'm always happy to chat as well if you want to brainstorm about School Lunch Hero Day too.
Awesome. Thank you.
Well, I just want to thank again our panelists. I love doing these sessions because I learn so much and I'm always excited about everything that I just learned. Carrie, something that you brought to attention that I want to just lift up right now is the difference between the foods that vendors sell to a grocery store compared to a school, because I am more of a physical activity person, not a nutrition person, but I can't tell you how many times someone comes to me complaining that their kid got a Pop-Tart. In my mind, I'm like, I don't think it's like an average Pop-Tart, but I'm so thankful that you brought that up and lifted that up and brought that to our attention, that they're doing their best and they do have those strict guidelines. And it's there's so many mandates out there, but the accountability for that one and the work that our Department of Ed does to support the school districts is so important. And then Carrie, Farah, I really appreciate you bringing to attention all of the community and school-based nutrition education programs that y'all have available, because like y'all have mentioned, it's one thing to serve the food or to make the food available. It's another thing for the consumer to understand how to use the food.
Absolutely. And they have to want to eat it. So we help make that happen.
Absolutely. So everyone's still left on the call with us. If you'll just, react, hand applause, whatever. It's been a great morning. So thanks again, y'all. And yes, we'll send a follow-up email. It's going to include a recording. It usually goes out about a week after the webinar, so look out for that next week. And we'll also include a PDF of the slides due to the size of the great images and information, as well as any other additional follow-up resources. And like JC put in the chat, please complete the survey, especially if you want a certificate of attendance for the day. So thanks, everybody.